Hello, family members. Welcome back here. It's been ages. I've been off this platform for quite a while. First was for some good reasons, then some things that were not very palatable. It's been really difficult in the last few days, but I really want to appreciate God because He has proven to be good, and in all things we are giving Him all thanks through it all glory to God. Now, while navigating the pathway to Australian nursing world, I know many of us are keen of moving. Some want to move from Nigeria to Australia. Some are in other countries already, Ireland, Canada, United Kingdom, and they are planning to move to Australia to practice nursing. And not many of us want to remain at the level of at which we entered into the profession, like entry level nursing, and be doing banks and agencies alone. We want to aspire. In fact, I believe that like 90 something percent of people coming from Nigeria aspiring to get the best out of the profession we've chosen. So many of us, very huge number of us, really want to make a beautiful career out of this nursing that we've chosen. So we want to look at specialties that could make us buoyant in the nearest future, that we don't necessarily need to run after so many things, but we'll be benefiting optimally from the profession in that particular career that we find ourselves, like specialty that we find ourselves. So we must have known by this time that Australia is a very prosperous land for many professionals, not just nurses alone, but then nurses having it beautifully outside there. And so you may be curious about that specialty in nursing that pay nurses very well, like mouth-watering payments that make people comfortable. Let's look at the highest paid nurses roles in Australia. And because we are experts in our field with so many responsibilities to carry out, we have significant influence in treating and meeting patients' needs. And there are many areas of nursing jobs around the globe that require different kind of qualification and experiences. So if you've studied nursing in Australia, or you are going to study it there, or you've already studied nursing and you want to move in there to practice, then start looking at these areas. Even if you want to be in the country where you are, especially if it's a developed world, and develop your skill around this line while you are trying to put in your registrations so that you will meet up with enjoying the best of your efforts, then you look at nurse practitioner. To practice as a nurse practitioner in Australia, you'll be earning like 130,000 Australian dollars per annum. It's not too big, but it's not too small. And that's like your entry level payment will be about 127,000 Australian dollars, which is not bad at all. And by the time you rise to the senior level, this very senior level, you'll be earning close to 140,000 Australian dollars. And honestly, it's not about the years of practice here to push from entry level into the nurse practitioner role, and then it is you moving up, doing all expanding your scope of learning and expanding your scope of skills. Then you'll be able to move into the maybe mid-level or senior level role as a nurse practitioner. So a nurse practitioner is that nurse who is a professionally trained person to provide a wide range of healthcare services to patients. So these are the things you'll be doing, and you'll be engaging in diagnostic and pathways to treatment of illnesses, and you will also be treating the illnesses of patients. You will also engage in giving health information, especially on health promotion and disease prevention pathways to the patient you are meeting. You will also be a coordinator of care. Honestly, you must have gained an advanced knowledge and skills in diagnosing and managing common medical conditions. Then you should be able to order some diagnostic procedures. You should also be able to interpret the lab results, and you should be a prescriber. So, if you're looking at becoming a nurse practitioner in Australia, while you wait for your registration to pull through, or whether your registration has pulled through and you are still trying to wait it out and maybe do some things in the country where you are, if you are in a developed world country, I will encourage you to look at getting into the prescribing roles wherever you are. So you may want to take up some courses that will earn you the opportunity to step into that shoe in the nearest future. And if you are already there, then it is beautiful for you. If you are registered already and you are still planning to move, or if you are not yet registered and you're still trying to register, as a nurse practitioner, you will be giving out complete health care to patients in diverse areas. Talk of clinics, it may be private practices, like it could be GP clinics, it could be nursing homes, it could be within the hospital, just name it. You are very much needed at very many special places. So, nurse practitioner and the flowers here, they are the best paid nurses in Australia. If you are already one, congratulations. So your next move would be to just move in and start earning big. And if you are stepping into it, I wish you 100% luck in it, in Jesus' name. Now, the very next one we talk about now are the nurse consultants. And these guys, their entry level salary is about 115,000 Australian dollars. You can all do this conversion with whatever currency of your desire and see what you may be earning with time. So, and at most senior level, you may be earning close to 130,000 Australian dollars too. That is not a bad thing to put into it at all. A beautiful one. If you want to look at getting into this, it is lovely, and you must actually have your first degree anyway, and possibly ensure you have your MSc. Now, what will you be doing as the second best paid, best remunerated nurse in Australia, as a nurse consultant? What you'll be doing is to guide, to advise, to provide needed support to healthcare professionals, organizations, and patients. So other colleagues will need you to encourage them, to advise them. This is the way to go about this. You are acting maybe sort of like a professional guide. You are like the professional compass for most professionals for most nurses in the hospital where you've been employed, or maybe in other places where you may find yourself working. So, and you will be part of the organizational decision makers. Very, very important. You have to be versatile in managerial things so that when they come to you for a guide, you will have a very big intellectual outlook, exposure to whatsoever the organizational needs are. So in that stance, you will be able to give accurate or near accurate counsel to those who need your help. So you should also be ready to provide expertise advice on various issues like patient care, legal and ethical issues, the health policies, the nursing practice, the clinical casework, and so many other things. Honestly, you possibly may thrive better in this if after gaining ground in your area of specialty, you take some courses in health management, because these are the areas they will be discussing mainly about legal and ethical issues, policies and policy making, audits and auditing processes, and all these things. So it is a well loaded and enjoyable part of nursing practice. If this is what you desire, honestly, don't waste your time. Go along with it. I know there is this is it CAF? They have this health management program there, and since they are subsidizing payment for the trainings, I think if you are looking at becoming someone like this, I know there are other pathways people can take to become nurse consultant, but then you may look at this management part of it. Honestly, yeah, it's something that is very, very interesting. I remember there was a time I was looking at New Zealand's head nurse, the national head nurse of New Zealand. She left the UK NHS. So I think our UK NHS is doing very well in raising nurses to be the best in that area that they want to function and to help their career to progress. So if this is you, you may consider taking up that course with UNICAF and start applying to the jobs around this particular area. Your payment is very huge. And honestly, I believe someone like me will enjoy this kind of a thing, because you sit down, you plan with people, you make policies, you look at the impact of the policy, you look at change making, you want to be a transformational leader, and what have you. It is all encompassing. If this is you, go right into it and win big. Thank you. Then we move to this nurse manager role. Nurse manager in Australia, they carry the big or huge responsibility of managing the nursing staff and overseeing the daily activities of a healthcare facility, that like operational activities of healthcare facilities where they might find themselves to be practicing. This role requires that you must be a leader, like that full ground leader that have strong clinical skills, that can command, oh, this is the way to do it, this is not the way. So when people are getting stuck, you are stepping into it and you are clearing it, and you are making the work in practice easy peasy lemon squeezy. Like you are making it a walk in the park for the leaders under you. So if you want to actually look into this, you too yourself, you must be clinically oriented and you must be very strong with your skills. So it won't be like when people are struggling under you, you get there, you cannot do things, you cannot make change. So you should have developed yourself to this level, such that when anyone is saying this and this, you know where it is leading to. Like you know the end products of the discussion, and you know where to change things, you know what's the best way to do it. Like if for you that a patient, maybe the glucometer is not working and this patient is diabetic and this patient is sweaty, maybe the band 5 is struggling and the band 6 maybe was not on ground or busy with some other patient, and you are the person managing the ward for that day, you should be able to look up and say, oh, from experience, these are the possible things happening to this diabetic patient. You should be able to make a decision that will impact the care of your patient positively. That's what nurse managers do. And they are well paid for their roles. They are paid, at least the entry level is above 100,000 Australian dollars. I mean, the basics above that one. And averagely, they may be any close to 120,000 Australian dollars. And as a senior, your salary too is like about 130,000 Australian dollars. These are without you doing all the extras or you doing all the awkward hours on social hours. And I think it's a beautiful one. You must also have at least a bachelor's in nursing education. If that's you, good to go. Next person will be the emergency room registered nurse. You know, here they just pack everybody together, and doing that. Like if you're an emergency room nurse, I don't think your payments are different from what every other person are earning. But in Australia, it's different. If you're an emergency room registered nurse, your entry payment will be from about 110,000 Australian dollars. And honestly, you could earn as much as 140,000 Australian dollars for working in your regular hour, not the unsocial hours too. You must at least have a bachelor's. Virtually all these things we are discussing about nursing is you having bachelor's, and you having bachelor's. And what will you be doing? You carry out professional assessment of your patient, nursing assessment of your patient, the head to toe, and every other ones that you need to do. You do the auscultation, you do the palpations, the percussions, and all those things, and you provide medical treatments and administer medications to your patients. You also monitor the vital signs and note the early deviation from normal and act in accordance, whether you need to signpost to other professionals, whether you need to put up an action that will help the patient immediately. Also, you wade into the areas of ensuring that life-saving measures are put up for patients in the emergency room. Honestly, you act as a very big shoulders to lean on for your patients and their family members, disseminating information from patients to team members, from team members to patients, and all that. And you still act as overseer of care, or someone who sees, overseer of the care that your patients are receiving under your other colleagues. It is a huge but very much rewarding role, because in most situations, in fact, most patients in the hospital will pass through the emergency room before coming over to meet other patients on the ward. Of course, it's not in all cases, but most patients that come into the hospital pass through the emergency room. And so you must have a top-notch skill. Know what you are doing, like at the tip of your fingers. The things you are doing are there. You are doing the ECG, you are interpreting the ECG, you are doing so many things, and you are doing them as perfectly as possible. That's not a unit where you can afford to guesswork. No, not at all. Because the life of so many people so much depend on you. Their safety so much depends on you. And I wish you success in all that you invest your time into. The payment is juicy, and I'm sure as an emergency room nurse, there will always be room for you to do the unsocial hours. Yes, you will have very strong interpersonal relationship to back up whatsoever you are doing. You must be resilient. You will have patients who want to turn everywhere to everything and anything. You must be able to wade in and ensure that you resolve the conflict in very, very good time. Doing this will help you to grow well in your profession and also to enjoy the dividends of working in this unit. Yeah, I think we can call it a day here, and next time I will start with this certified registered nurse anesthetist. Before, I used to think that these guys are the best paid, but in some situations things change. Yes, let's see how it goes with these nurse anesthetists, and in the nearest future we go more into it. I wish you success. Don't forget to subscribe, share the information here with your friends and family members, and develop yourself to meet up with these roles soonest. Thank you very much.